This might surprise you to know that every dentist can treat snoring. Remember, it is applied dentistry at its best, and every dentist who's been trained well can include the snoring appliance in his practice. Dentists have a very major role to play in the treatment of snoring. But before we go ahead, let us try to understand what exactly is snoring. Snoring is an upper respiratory tract disorder. Most people understand that the irritating sound of snoring comes from the nose. This is not true. The sound comes from the throat caused by the vibration of the soft tissue in the palate. So the sound of snoring is caused by the vibration of the soft and unattached tissues in the throat. The passage of air through a reduced opening will always result in vibration of the surrounding structures. This vibration causes sound. The same principle applies when we whistle. The reduction in the airway takes place due to the backward positioning of the tongue and the mandible during sleep. The tongue falls back and presses on the windpipe, thus reducing the size of the opening. When air during breathing passes through the reduced opening of the windpipe, vibration is produced and it causes snoring. This pictorial description will depict for you as to what really is happening. You can see that the tongue has fallen back in the throat and the reduced airway is now causing vibration in the surrounding tissues, which causes the sound of snoring. This occurs during sleep, can be very irritating and very dangerous for general health. This is a vertical section of a schematic representation of the upper respiratory tract. You can see that the tongue, when it falls back, it presses onto the windpipe, thus closing or partially closing the windpipe. This partial closure causes the air to create a vibration in the tissues surrounding it, and this is what causes snoring. The treatment will therefore require the repositioning of the mandible and the tongue. The mouth is the area of work of the dentist. Dentists are best suited to help reposition the mandible. This will help maintain the opening of the windpipe and prevent snoring. Dentists work in the mouth and are best suited to treat snoring caused by the backward positioning of the mandible. This is applied dentistry at its very best. You can easily take to it because all the procedures are you have already attended to in different forms. The big and serious question is, why are most dentists not treating snoring in their practices? I'll take you back to 20th December 2004 when Time magazine, the famous Time magazine of America, featured sleep in one of its issues. Here it says upper airway sleep disorders are potentially life threatening. The ability to treat the patient may be critical. Dentists are recognized as an integral part of the treatment team of these patients. Even though numerous publications are available, most dental schools do not include the treatment of upper airway disorders as part of the curriculum. So, most of the dental professionals are not able to manage these disorders. This is, I'm quoting John R. Ivanhoe, who wrote this in the special issue of Time magazine, which was devoted to sleeping or to sleep. The science of sleep has overtaken the world in all forms, and it has been recognized now. There are a lot of diseases of the general diseases in human beings is because of sleep patterns being disturbed. So why should snoring be treated at all? Snoring must be taken very seriously. Snoring can kill a person during sleep. Now, if that is not serious enough to think about, I wonder what could be. This is a serious matter which requires our due consideration because we can be fully involved in helping people to survive. By treating snoring, a dentist can actually help save a life. This adds a new dimension to our profession, that of a lifesaver. So long we are not designated as lifesavers. Air is very important for life. During snoring, the amount of air going to the lungs is affected. This means that the body does not get this full quota of oxygen. The reduced oxygen affects quality of sleep. The person feels tired and does not feel fresh during the day. This leads to a general debilitation in the body, and the person is then open to all kinds of diseases that take place in the same time. So sleep is important, and the quality of sleep is important. The snoring affects the quality of sleep. A large tongue may also be controlling factor to the reduction of the airway leading to snoring. The retropositioned mandible also reduces the airway leading to snoring. It is generally said that the person who snores is having a wonderful sleep. Actually, the person's body is crying for help. It is being deprived of oxygen with each breath, and that is definitely a very serious matter. On the lighter side, we see cartoons wherein the women are being disturbed, and it is said that a man cannot speak in a high tone. It's because God allowed him to snore only at night. If he can't sleep, if he can't speak in a high tone to his wife or to his wife. Here, this another famous cartoon shows that the woman is so disturbed so far as the her husband is or her spouse is snoring so heavily. But this is not true. Snoring is common to both males and females. It does not have any gender binding. Everybody is snoring. Everybody around is snoring. Now, uncured snoring leads to a very serious medical condition called OSA, or obstructive sleep apnea. Apnea means total absence or of air passing through into the lungs. Now, the partial obstruction is causing snoring, and the total obstruction can cause apnea. That means no air is allowed to reach the lungs. Snoring is common to all stages of obstructive sleep apnea. This makes it very interesting and also increases the scope that we hold so far as treatment in OSA is concerned. Obstructive sleep apnea, when the pressure on the windpipe is excessive, the passage of air can get totally blocked. This means no air is passing through to the lungs, and this can cause death during sleep. Number of times it has been noticed that person has been found dead in the morning, and the family generally says, "Oh, he was snoring so wonderfully last night, and in the morning, I don't know what happened. We don't know what happened, and we found him dead." OSA is a silent killer. People die in their sleep with this condition. Now, if we can interfere in this and we can help in this, we actually help to save lives. That definitely increases our status as dentists in the general medical system. We then become lifesavers to the nation. OS is a silent killer, and unless it is the history is known, anything can happen to the patient during the sleep. When air is cut off to the lungs, the brain gets an alarm, and the person wakes up with a start, clears the throat, and goes back to sleep again. We must have all noticed this sometime or the other in our family or around us. The sudden jerk to the system, wherein the breathing starts again, can cause a severe jerk to the system, which can cause heart failure leading to death. So, this is definitely very, very, very dangerous because the brain starts the system with a big jerk, and when the jerk comes in, the heart may not be in a position to take that jerk, and what results is heart failure and death. Now, this is definitely you. Everybody must have noticed this sometime or the other in the family circles or in wherever you live around and heard people say that. Causes of snoring can be overweight, age leading to loss of muscular tone. Our lifestyles are helping us out in that. Enlarged tonsils and adenoids. Natural causes are genetic and familial. Frequent use of alcohol and smoking. Alcohol is a depressant, and it relaxes your muscles also. And when you use that, the system, the all the muscles in that area become loose, and the result is that they're falling back of the tongue into the throat, and that causes you to snore. Now, how dangerous is OSA? Untreated OSA can reduce more than 12 years of your life. Smoking reduces 7 to 10 years of your life. Diabetes too reduces 5 to 10 years of your life. And OSA increases the risk of death by 46% through stroke, hypertension, and heart disease. It is there for all to see, yet it is escaping our attention because most people don't generally pay a lot of attention to whatever is happening so far as snoring is concerned. I have said this time and again that snoring is dangerous, and I hope I'm not being a nuisance to you just repeating it again and again. Because as a senior dentist, and I'm an orthodontist, I want every dental surgeon to understand this and be a part of this treatment procedure. The treatment of OSA is not in the scope of dentistry. It is very specialized subject and best left to the super specialists, the pulmonologists. They are the best suited to treat the OSA, but we can definitely help them in controlling or treating the snoring part of it. The treatment of OSA is not in the scope of dentistry, and therefore we should not talk about OSA at all. We should confine ourselves to talking and discussing snoring. We are on safe ground there, and that's very important. Snoring occurs as a symptom in obstructive sleep apnea. Snoring is a major symptom in all forms or stages of obstructive sleep apnea. Snoring is the first sign of OSA. It is safe to say that almost 30 to 50% population is snoring and can develop OSA. It is a very large number in India with a population of 1.4 billion people. Can you imagine how many people are there looking out for our help? Only because we won't talk about it and people don't understand what we can deliver. So, this means a huge field is awaiting you. So it's time we take interest and try to get into this area which is ours, because repositioning the mandible is our field and we must see that we take part of it. Three treatments are available for OSA. One is the CPAP, or the continuous positive air pressure machines. Then number two is surgery in the roof of the mouth, which is called ovulopalatopharyngoplasty, which is carried out by ENT specialists. And third, last but not the least, oral appliances used for repositioning of the mandible. The CPAP machine forces air into the lungs through a mask fitted on the mouth and nose. They are very uncomfortable, very expensive, and do not address the main cause of the obstruction. See, a basic idea is to supply the body with a measured amount of air that it needs. It doesn't help to address the basic cause, which is the distal positioning of the mandible and the tongue. Now, they are not very popular because they're very expensive and they're very cumbersome. So, a lot of times people discontinue this. This is what a patient wearing a CPAP mask generally looks like. They have different variations of the masks depending upon people's fancies. They pick up with new things, but at the end of it, it is not comfortable. And the palatopharyngoplasty that is conducted in the roof of the mouth by the ENT surgeon again does not address the main cause of the snoring or the obstruction caused by the distal positioning of the mandible and the tongue. So, and it is well known and it's in the literature, available in the literature, that the tissues which are excised and thrown out have a tendency to regrow. They grow back again. Oral appliances delivered by the dentist have proven to be the most effective means of treating snoring and OSA. The success of these appliances is based on the fact that the advancement of the mandible has a very positive impact in increasing the upper respiratory tract aperture and restoring its function. This treats the basic cause of the problem by repositioning the mandible to open the airway. Nothing can be more specific than this in the treatment of snoring with oral appliances. Oral appliances are delivered best by the dentist. Here is a picture of an oral appliance which is placed in the mouth. There are two sections to it. The upper section which fits the upper teeth and the lower section which is the lower teeth. And there's a locking system which holds the mandible in a protruded position. Now, advantages of the oral appliances as delivered by the dentist: effective in enlarging the airway, reasonable cost, ultra lightweight, custom made for perfect fit in the mouth, allows the individual to sleep in any position. Now, if you have a mask on your face, on your nose, and your mouth, I wonder how you can sleep comfortably. The advantages of oral appliances continued would be easy to clean and maintain, easy to carry anywhere in the mouth, in the pocket, do not generate additional noise, do not need power supply, do not require assistance for wearing and removing. And most important, it can be made by a dentist. So you are in a position to make this and enter this huge field which is waiting for your padarpan, let's say, your footsteps. Diagnosis and management of OSA is best left to the medical specialists. But the management of the OSA is in the realm of the dentist. Snoring is common to all the three stages of OSA: primary, moderate, as well as severe. All these three forms, so the snoring is definitely prevalent. So we have to understand and get into this system. If you don't treat it, the complications of snoring lead to hypertension, that is high BP, coronary heart disease, congestive heart failure, diabetes, erectile dysfunction, renal disease, obesity, loss of concentration, and dryness of the mouth. Now, these are very serious conditions of present day, modern day living, where our lifestyles have changed and things are getting bad to worse because people are definitely getting affected by all these diseases. We have confined ourselves to teeth and its surrounding structures. It is time to move up the ladder and offer ourselves as serious players in the health field. We can play a very significant role so far as the treatment of snoring and the management of OSA is concerned. This definitely widens our horizon. Snoring can take place with or without obstructive sleep apnea. Now, you don't need to be a obstructive sleep apnea patient to be snoring. It can happen without that, because in the formative stages, you could just be snoring. The patient could be just be snoring without the OSA. Therefore, it is important that snoring should be considered. The OSA best left to the medical specialists. That is, snoring with or without OSA offers a great opportunity for the dentist with oral appliances. Now, you should take a look at this advertisement. This is by a multinational, and they are generally making CPAP appliances which are sold on the prescriptions of or otherwise without prescription, with and without prescription, to people who are suffering from OSA. Now, when they advertise, they don't talk of OSA, they're talking about snoring. See, because snoring is where the main crux of the whole problem lies. There, like I said, there are lots and lots of people who are snoring but without having the ASA. So here it is a situation where they are trying to sell directly to the patient concerned, the patient who's snoring, and most of them. This depicts a couple wherein the lady is so harassed that, and there are situations where it leads to divorce, and people just don't want to stay together again just because the person is snoring. So we should also talk only of snoring and not of the OSA. It's not our area in any way. Okay, marketing strategy of the multinational company. These advertisements only mention snoring and not OSA. We need to do the same. Don't try to offer treatment for OSA. Concentrate only on snoring, because you will be able to communicate faster when you talk about snoring. You can't talk about OSA. It's not your field, like I said. Selling directly to the public, which is snoring, is really important. You need more proof. Okay, dentists are the best persons to treat. I have said this earlier also, and I'll repeat this for your benefit. Read this fine print. Upper airway sleep disorders are potentially life-threatening. The ability to treat the patient may be critical. Dentists are recognized as an integral part of the treatment team of these patients. Even though numerous publications are available, most dental schools do not include the treatment of upper airway disorders as part of the curriculum. So most of the dental professionals are not able to manage these disorders. Sorry, I have to say this again to you because I am trying to force a point, and this is the best way I can do it. Now, there are two very well known organizations in the world, that is called American Association of Sleep Medicine and American Association of Dental Sleep Medicine. They gave guidelines in 2015, and these guidelines are very interesting, and definitely they are in our favor. So I have mentioned them here. Please listen to them and read them carefully. He says, we recommend that sleep physicians prescribe oral appliances rather than no therapy for patients who request treatment of primary snoring without sleep apnea. Now, can you imagine what it does to our field of working? It opens up a huge field for us to be working in. They are recommending to their physicians concerned, sleep physicians, that please prescribe oral appliances even if the patient has come with for snoring and does not have what do you call sleep apnea or OSA. He doesn't have OSA, so please give him that. Second guideline is, when oral appliance therapy is prescribed by a physician or an adult for an adult patient with obstructive sleep apnea, we suggest that a qualified dentist use a custom made titratable appliance instead of a non custom made oral device. Now, this is important because there are a lot of appliances available in the market. So you just order it and it comes to you in the mail and the people fit it. Now, these are not made to order, they are not titratable, and they are definitely not custom made. The dentist is definitely in a position to give you a custom made appliance, and it is titratable. Titratable means it is adjusted, it can be adjusted to be having a comfortable fit in the mouth, and the patient should be able to do it himself. The third guideline is, when oral appliance therapy is prescribed by a sleep physician for an adult patient with obstructive sleep apnea, we suggest that a qualified dentist use a custom made titratable appliance instead of a non custom made oral appliance. This increases our workload. If we can push it through, we won't be able to go home to relax with our families. There's so much work to be going. So this is definitely an area which has been left out by us. And the last, we recommend that sleep physicians consider prescription of oral appliances rather than no treatment for adult patients with obstructive sleep apnea who are intolerant of CPAP therapy or prefer alternative therapy. So, in case a patient doesn't is not used to or doesn't like the idea of having a CPAP machine with all that mask and everything attached to him, and it doesn't mean that no treatment is available. Treatment is definitely available. Both the associations guideline 2015 says that a oral appliance made by a dentist must be prescribed to such a patient so that the patient gets good treatment and continues to get good treatment. These are very important guidelines, and I think we should study them and maybe take them out and print them and post them in our offices to see exactly what is going on. Then, last, we recommend that qualified dentists provide oversight rather than no follow up of oral appliance therapy in adult patients with obstructive sleep apnea to survey the dental related side effects of occlusal changes and reduce incidence of the same. Now, when we apply these appliances, when we wear these appliances for the patient's mouth, then a slight change in the occlusion may come up. The literature says that they are not very disturbing, and the occlusion which does get affected may be very slight. There could be a slight pain in the TMJ, but that is manageable. It is nothing. We must understand what needs to be seen is the advantage or the of wearing these things. The side effects, maybe there are side effects with everything, but the good points or the advantages of wearing this appliance far outweigh the side effects, which may be very temporary. You can easily offer the treatment of snoring in your clinic. It is a great opportunity, grab it. It is a multi-billion-dollar industry in the USA, and 50% of India, both males and females, are waiting for you to step into this field. Don't ignore it. You can easily learn it, and like I said, it is applied dentistry at its best. The million dollar question is, should I start treatment of snoring in my practice? And how do I start with treatment of snoring in my practice? Well, this is what people generally understand, is that they all know, they are always doubtful, okay, should I do it or should I not do it? Should I do it or should I not do it? With such a great opportunity at hand, and like I said, it is applied dentistry, you should consider getting into these areas. The answer to the first question, or should I start treatment of snoring in my practice, is a definite yes, yes, yes. Treatment of snoring is a multi billion dollar industry in the USA. Whatever starts in the USA comes to India in quick time. The cost of the appliance in US is a cool $5,000. In India, it can be offered for far less to a huge number of patients. See, what we fail to understand or overlook is the sheer size of our nation in terms of population. Imagine that population, and with 50% wanting these services, we should be have no dearth of work. So there is no question why you should not enter or why you should not include the area of snore cure or treatment of snore into your practice. Snoring does not require extensive diagnosis. The family members will confirm the diagnosis. Dentists should try not to offer treatment for OSA. OSA is not our field. Snoring is our field. Just stay there, stay put. Do not antagonize the the gentlemen or the ladies who are treating the very highly specialized area of pulmonology. We should not. We should keep out of it. We don't like people interfering in dentistry, so nobody will welcome you if you try to put your foot in and say, okay, oh, you are treating OSA. You are not going to be in any way be qualified to treating OSA. So please stay out. Just talk snoring, snoring, and snoring. Leave the OSA just for the understanding of the subject, and that's all. There's no point our stepping out of our shoes or of our area and getting, hurt in the process. We are in an infant stage of treating with snoring. Let us develop it further and then we look at it. For dentists in practice, opportunity nowhere transforms into opportunity now, here. You have to recognize an opportunity and grab it with both hands, so that you do well and serve your community. Like I said, it will raise your status of a lifesaver once you enter into the treatment of snoring. Dental colleges are not teaching this important subject. Don't let that bother you. They never taught you how to practice either. It is applied dentistry. You can easily learn it online or offline. Don't waste any time. Start today and prosper. Answer to the second question is, where do I get my training? You should go to www.indian institute of orthodontics.com. This offers you online as well as offline training. You can take the training on a one day's program in Ahmedabad, or you could take it on the net in the comfort of your home. With those few words, I thank you very much for a patient here.